Hello friends, Dr. Larry Mitnaul, your friendly neighborhood child and adolescent psychiatrist. I want you to imagine with me for a second. So imagine that your child had some really difficult behaviors lately. Maybe they've had a significant change in their mood where it just seems like they're angry all the time. Or you could imagine maybe that a child is going through, where they're feeling like their happiness is a little bit dimmed, or they're suffering under the weight of a lot of anxiety and worry. What do? You're likely to talk to family, talk to friends, talk to clergy, or maybe even your child's pediatrician. And one of them is likely to recommend that your child see a child and adolescent psychiatrist. Now, once you've been picked up off of the floor, your mind may actually start racing with some more practical concerns like, what are they going to do at the appointment? What does this even look like? Maybe what should I bring to be prepared for such an encounter? And so you may even have silly thoughts like, maybe the dog that the kid plays with all the time is more aware of all his shenanigans than anyone else in the house. All right, don't bring the dog. Don't bring the dog. But what I'd like to do is spend some time demystifying the process for you, helping you feel more confident about what a visit actually entails. And at the end of this, you'll actually get to hear some of the surprising insights that parents and kids often say after a psychiatric visit. So stay tuned for that. Now, before we talk about the process of understanding your child's brain, I'd first like to get your help in the process of growing our mission here on YouTube. Really, our mission is to empower families with just great information. And it turns out that when you comment, like, and share, it encourages YouTube to do the same and to help us to spread the message. And so this helps the more than 15 million kids who could benefit from such expertise but don't have ready access to the only 8,000 child psychiatrists that happen to be strewn and scattered all around the US. So anyway, thanks for helping us to reach those kids and those families by smashing that like button. Now let's get into it. So you are not alone in having this question. Parents, other doctors, colleagues, ask for some of the same information. For those who've followed the channel for some time, may even remember a video I did 2 years ago talking about the process of a psychiatric visit. Well, it turns out that in the time, in that span of time, my own practice has grown and certain processes have changed. So here's your update of what you might expect, although the bones really are the same. The first part of the psychiatric evaluation really relies on gathering quite a bit of information and data about your child and the family. In some cases, parents may have to bring in a few things to help the appointment really run as smoothly as possible. Things like a special education plan that your child may have from their school. Maybe they've had some psychological testing done in the past. Perhaps your kids have been on various types of medications, not just for mood-related issues, but also for seizure or other health concerns. So having these things and knowing what they are can be really helpful for us. I mean, one way to think about, this mini list of things to bring in is like packing a rucksack for a great quest or adventure. Okay, parents, that's me, honestly, trying to be encouraging, as I know for some, it won't feel like, packing for an adventure and more like preparing for, packing your family for a very long vacation. So, and speaking of vacation, so my favorite family packing list came to us from some really great friends, and it reads something like this. Things to bring for mom: toothbrush, shampoo, chocolate, socks, shirts, chocolate, hairbrush, chocolate, right? I mean, it's the best. It has all the elements. All right, so let's go back to your family. Now, you don't have to bring every note written about your child, ever. Sometimes we get stacks of, kind of clinic notes for the last 10 years, and often there's too much volume for us to go through in one sitting. Or every letter written by a teacher. So just having the summary statements from either the school and their education plan should be plenty and sufficient to at least get us started in helping to know your child. Now, during the appointment, we ask about many different things. So, birth, were there any complications or trauma or need of postnatal care in the hospital for your child? How did they do on developmental milestones? So that's like their first words and first steps, and are they right or left-handed? We're also interested in the family history of both medical issues and psychiatric illnesses. And so sometimes parents can be caught off guard and wondering how this can be helpful, but the genetics are actually important for us too. And then if there's been any testing, like the testing that I mentioned before. All right, so what else do we want to know in these types of encounters? So in addition to getting the information I shared with you earlier, we're also interested in how families or a particular family is organized. I mean, what are the roles and responsibilities at home? What are some of the family rituals, some of the family habits? What's the family style of humor like? And of course, these pictures that we get then better allow us to understand the main issue that's bringing your child in to see me. So often, I like to begin with seeing the family all together in one room, telling their story about what's going on and what they've seen. Now, later in the appointment, I will save time for meeting with the child individually and the parents individually as well. And this allows for parents to share more specific concerns that might not be appropriate to share while we're all together. And having the kids alone in our one-on-one session means that I'm able to do some more focused assessments too on some of their motor skills and memory and social engagement while using some play and conversation to do that. And so often at the close of our time together, which may be 1 or 2 visits, we'll circle up and talk about ideas for helping your child to thrive. So that's broadly the overall format of what you can expect in an appointment. So you might be asking them, what are the things that parents and kids are surprised by in your clinic that they mention? All right, so here are a few, or maybe my top 3. 1, parents can often be surprised with how much we laugh together during an encounter. I mean, even when we're talking about some of the hardest material or hardest kind of subjects or things that they're encountering in life, I find that there's so much room for humor, and it almost always just naturally comes up during the course of our time together. So that's 1. 2, I think sometimes parents are surprised by how much their kids talk and how honest they can be. I mean, certainly there are shy ones and kids who are a bit more aloof, but there are many times that once we get talking and things start to warm up, the anxiety quickly melts away, and we're just on to the conversation of better understanding their life and how I might be helpful. And then lastly, I think parents are sometimes surprised that we don't start with medications. Parents, I think, correctly recognize, child psychiatrists are physicians, and physicians can prescribe medications. Now, in child psychiatry, we are often focused on helping a child's brain development and growth. And so, overwhelmingly, our strongest preference towards enhancing a child's life is through therapy, or through family-based interventions, or diet, or exercise, or sleep, or sometimes doing blood work too to understand other things that might be going on below the surface before considering any interventions like medicine. So families are surprised, I think, that their child may be seeing a child psychiatrist and there may be no medications involved whatsoever. We're just talking and working on the problems ahead and collaborating together. All right, friends, thanks for watching. Take good care and please be well.